All right, this morning the doctor's in. We are into it, right? The cold, dreary days of winter. For many people, it can lead to a type of depression. It's called seasonal affective disorder, or SAD. And it happens mostly in the fall and winter when there's less daylight, which can actually affect your brain. So let's talk about what to do about it. How can we treat this? Dr. Michelle Davila, a naturopathic medicine doctor with Corewell Health Integrative Medicine Department, is here. Doctor, thank you for being here.
Yeah, thank you for inviting me.
Real quick, explain to people what integrative medicine is, naturopathic medicine.
Yeah, so integrative medicine, it's really a blending of a lot of these natural holistic methods of medicine with kind of the more conventional approach. So we use multiple therapies, and really the goal is to enhance conventional care. So rather than, we don't use the word alternative anymore because we're not trying to be an alternative to conventional medicine, but how do we blend them together for the best of the patient?
I mean, to me, it makes perfect, it seems ideal, really, because you're looking at big picture stuff.
Yep.
You know, stress, sleep, diet, all those things, in addition to what might be going on inside. Let's talk about SAD. How do you know? Because all of us, I think all of us feel a little, you know, get a little down this time of year. Sometimes it seems so dark and dreary, right?
Yeah. Yeah, so I mean, there's a spectrum of kind of disorders and dysfunction ranging from, you know, a severe depression to just kind of like down sometimes.
Right.
So, you know, in terms of how you know where you fall, it really a clinician or healthcare provider would be able to kind of navigate all of this with you, but it's really, there's this characteristic seasonal fluctuation to the symptoms where they tend to come on in the fall when, you know, the daylight is shorter and the days are getting shorter, and then kind of remit or resolve in the spring, and then it's a lot of those kind of depressed mood type of symptoms.
Okay, very good. So yeah, if you notice these symptoms, this pattern, then you might be dealing with, and it is a clinical diagnosis. Okay, what are the treatments? I know you got your top three.
Yeah, so all of these are evidence-based and can be used alone or in combination, but psychotherapy is a first-line treatment, as well as medication, and then light therapy. And then exercise is also typically used as an adjunct to any of those, and it can also sometimes be used as a standalone, depending on how severe the symptoms are.
Since we're looking at video of the light therapy, let's talk about this. What do we know about light therapy? Is this something that you can buy these lights? What do you do, and how effective is it?
Yeah, so it kind of sounds like maybe it would be this sort of fringe or new therapy, but there's actually a ton of research to support it, even so much so that it's considered by conventional medicine to be a standard first-line therapy. But basically, they typically come as these light boxes, and it's a particular type of bulb. It's a white light, full spectrum light, and it has a particular filter on it so that the UV rays are filtered out, and the light is scattered to kind of protect the skin and the eyes, and so they are kind of specifically designed for this therapy. But there's a certain brightness that typically research shows is helpful, and so the light boxes have that brightness typically, and then you're usually about like 2 feet, 1.5 feet, or 2 feet away from it, and typically done in the morning, although some research shows doing it any time of day can be helpful, and most research is looking at about 30 minutes per day for at least like 2 weeks.
What is it doing to your brain? What is it? The light gets in your eyes and does what?
Yeah, so there's a few different theories, and the leading one is the same one that we've had for about 40 years or so, but the theory is that with the seasonal changes in the amount of light that we're exposed to, that shifts our circadian rhythm. So basically, we want to wake up later in the day than we normally would in the summer, but our schedules don't really change in the winter, so it's kind of this mismatch between what our body wants to do and what our schedule is telling us to do. And so there's some thought that having this bright light in the morning might help to shift that circadian rhythm so that it's more in line with what your schedule is.
And that can change your whole outlook then.
Yep. So it affects mood, alertness, cognition, energy, performance, all of those things.
Wow. All right. Good stuff. Dr. Davila, thank you so much. All right. Welcome back, everybody. everybody, the doctor's in. We're talking about naturopathic medicine, integrative medicine. What is that? Do you need it? Let's talk to Dr. Michelle Davila, a naturopath medicine with Corewell Health's Integrative Medicine Department. Doctor, welcome back. And just explain to everybody once again what integrative medicine, what that means exactly.
Yeah, so you think of the word integrative and you think about integrating. So we're kind of integrating some of these more natural, holistic ways of working with health with the more conventional approach. So it's kind of like the best of both worlds, blending the kind of more natural therapies with, you know, the kind of standard medicine that's out in the world.
And who needs a naturopath? Who should be looking for that kind of doctor? And oftentimes I know insurance, there's an insurance issue too.
Yeah. So the short answer is anybody could see us. So we work with people of all ages, and we can work with a variety of different health concerns, including just prevention and well-being. But I'd say the main categories of people that see us are people that have chronic health issues, and so it's a lot of chronic pain, functional digestive disorders, mental health, hormonal issues, sleep, stress, all of those types of things. And then also people where chronic fatigue too, so like people where you go and see all of the conventional doctors and specialists and everybody's kind of like, nothing's wrong with you or everything's normal, but I still don't feel well.
Okay.
So we see a lot of people that have that history as well. And then, in terms of insurance, so that's going to vary state by state. And in Michigan, we're not licensed, so we are working on that. But we can only provide complimentary care in Michigan. We can't practice medicine, and so because we're not licensed here, we can't bill insurance for our services.
Okay.
But the nice thing about working with the team at Corewell Health is we have a medical director who's an MD, and so she's able to bill insurance for lab work. So any lab work that we would recommend can be billed to insurance.
Okay, that's good to know. Okay. Liz wanted to jump in the conversation
because
too.
I can relate. I've definitely been open in sharing my journey with rheumatoid arthritis, which is an autoimmune condition, and I can tell you when you talked about that part, the diagnosis, I got sick with mono when I was in college, or probably around Sophie's age actually.
Okay.
And since then, I have never really felt well. And fast forward to my early 30s, I formally got a diagnosis. So think of over a decade I went.
So you got the rheumatoid arthritis diagnosis really
recently.
late. Yeah. Okay.
And doctor after doctor, and then just people telling me I was crazy, and then people over medicating, and just when you don't feel well chronically, it's crappy. Like nobody likes to not tell you what's wrong. And when people can't tell you what's wrong, and you're dishing out money, and it's frustrating. And so the fatigue part is something I deal with every single day. And so for a person who perhaps is fatigue or autoimmune, like what are some things that we can integrate and on top of my Western medication, which I take every day, what are some other Eastern kind of things that I can do?
Yeah, so each person we meet them as an individual, and so we'll kind of do a thorough health history and try to understand what are maybe the most important ways to help you as an individual. So it's going to vary person to person, and sometimes we do lab testing to see if there's like any obvious nutritional deficiencies or things like that. So those are all kind of like specific to the individual, but in terms of generally, I think three big areas are one, nutrition, kind of what we eat and what we're nourishing ourselves with, and we think about that more in like the overall pattern in terms of like which foods am I emphasizing, which am I de-emphasizing, rather than sticking to a strict diet. So more like, how do I make this work for me?
And we're showing, so we got your vegetables,
I like that,
which we know we're supposed to be eating our vegetables, beans and whole grains, and then olive oil, nuts, and seeds. So those are foods, Doctor, that you're saying if we can kind of focus on incorporating those in, that's going to make us feel better.
Yeah, so I kind of chose
no matter what you're dealing with.
Yeah, I chose those foods because they're part of an anti-inflammatory or low inflammation eating pattern, the Mediterranean eating pattern.
I was going to say, that's kind of my diet.
One example of that. A lot of traditional diets have, these different qualities, but all of those foods will help to kind of reduce inflammation and, just support overall nutrition.
Where can people read more about what you do? Because I think it's really interesting.
Yeah, give us your website or how we can understand, because it is a fascinating, different, perhaps for some people, approach.
A good avenue,
Yeah, so if you just go to the corewellhealth.org website, we do have Integrative Medicine does have a website there, and there's descriptions about all the different services that we offer, and we do even have some videos that were created over the last few years about kind of what the therapies are and, you know, some demonstration of them. And then specifically for naturopathic medicine, because the licensing varies state by state, like I said, anyone can kind of call themselves a naturopath in states where they're not licensed. So naturopathic.org is our national association, and that will kind of give you specifics about our education and training.
Important. Okay, good. Doctor, so much good
Nice to meet you. I'm definitely going to follow up. Thank you so much.
Yeah, thanks for having
Good
me.
stuff. We hope you guys wrote that down. Hey,